This is Dr. Jeff Shu. We're joined by Dr. Billy Caceres, an assistant professor at the School of Nursing and the Program for the Study of LGBT Health at Columbia University. Can you explain the minority stress theory, what it is, and how does it relate to cardiovascular health disparities in this population?
The minority stress theory, the minority stress model, has been around actually for decades, since the early 1980s. And it's this model to help us understand how stigmatized adults or marginalized adults like LGBTQ individuals experience excess stress related to their sort of minoritized or marginalized identity. In addition to the general stressors that we have just from living and being adults in the United States or in the world, things like family stress or financial stress, that LGBTQ individuals also experience added stressors related to their identity. Things like exposure to discrimination or violence, which are usually thought of as external to the individual. They're often called distal stressors. And then there's also proximal stressors that are LGBTQ individuals' sort of internalization of the experiences of discrimination that either they have had themselves or that they have witnessed either in their friends or just through the media. So it's sort of the internalization of a lot of your awareness of being a minoritized person. And there's a number of different proximal stressors is what we call them. And they can include things like internalized stigma, so having a negative perception about your identity, as well as this idea of vigilance or hypervigilance. But I think that sort of this hypervigilance or fear of discrimination, what drives a lot of LGBTQ people from avoiding certain healthcare settings or seeing certain providers. So the important thing to think about these minority stressors is that although they're unique to LGBTQ people in certain ways, that they sort of operate in in similar ways as we think of general stressors, right? So it's not that they impact people's behaviors or physiological outcomes any differently, but that they actually just occur at a higher prevalence or higher rates among LGBTQ people. And also bisexual and transgender individuals are more likely to delay seeking care due to fear of medical costs. So they're afraid of actually seeking care because they're not sure if they'll be able to actually pay for that care. So in addition to these like financial concerns in accessing care, there's also non-financial concerns, things like being afraid of being discriminated against, or being afraid that you're going to receive inferior treatment because of your sexual identity or gender identity. So how does somebody delaying care, maybe they've been told they have hypertension, but they've delayed actually seeking care for their hypertension or even seeing a preventative cardiologist for it, that's all tied, we think, to minority stress as well. But there really hasn't been research that examined all of those things together.